I think we can get started, and people can join as we can admit them as they come. But thank you all for joining so much today. My name is Avalon Aragon. I am a program coordinator here at the City Health Dashboard, and I'm also joined by my colleague, Samantha Breslin, who is a program supervisor. But yeah, thank you guys so much for joining. We can go ahead and get started. So today we are going to just start with a brief kind of introduction and background of the City Health Dashboard, and then we'll move into a short website walkthrough so you all can get a little bit more familiar with the dashboard and the metrics we have to offer. And then I'll pass it off to Sammy, who will talk more about our brand new CBO funding opportunity, and then we'll conclude with any questions any of you have for us. So our goal at the City Health Dashboard is to help cities across the country leverage the power of data to improve the health and well-being of everyone in their community. We created the dashboard with the ultimate purpose of helping mayors, city leaders, health departments, and other local organizations to improve the health of their citizens and communities. And so most data on health and the drivers of health were not organized at the city or neighborhood level, but rather at the county, state, or national level. And so the City Health Dashboard is able to provide that really local specific data to cities across the country. And so we currently provide over 45 measures of health to over 1,200 cities in all 50 states. And so the dashboard was developed back in 2018 by our team here at NYU Grossman School of Medicine within the Department of Population Health in close collaboration with our partners who are ICMA, MLC, NACCHO, and then our funding is provided by the Robert Wood Johnson Foundation. And so when developing the dashboard, we worked really closely with our various city partners on things like measure selection and website development to really make sure we were creating an easy to use one-stop resource to help create healthier and more equitable communities. And so in thinking about our measure selection, we apply a really rigorous criteria in selecting all the different measures on the dashboard. Our metrics are drawn from both federal and non-federal data sets that all adhere to really rigorous standards of collection and analysis, including the Census Bureau and the CDC. All of our measures also aim to be actionable and reflect public health priorities, especially at the city level. And then our team regularly updates the site with new years of data as they become available, as well as adds new measures across our different domains that we have. So this slide shows all the different measures that we have available on the dashboard. Like I mentioned earlier, we have over 45 metrics divided across these 5 domains of health outcomes, social and economic factors, physical environment, health behaviors, and clinical care. And also on the slide, you can see the metrics that have both city and neighborhood level data available, as well as metrics that have demographic details available. And so the City Health Dashboard is a flexible, easy to use tool that can be used in a number of ways to support you and your work. So for example, you can use it to help compare health gaps across neighborhoods. You can use it to compare your city to other cities in the region or with similar populations, and you can use it to help set priorities and better target resources. And so with that, I am going to move us over to our website to do a quick website walkthrough. So let me navigate to the site. Okay, here we go. Okay, perfect. So here we have our website. Our URL is just cityhealthdashboard.com, and this is our homepage. So to start off, you can just type in your city of interest. Today I'm just going to be using Columbia, Missouri as an example. And once you select your city, the metric selector will pop up, which will allow you to select any of these metrics to learn a little bit more. But today I'm actually going to start us off here at our overview. And so this takes you to our city overview page. And so on this page, you can kind of get an at-a-glance view of all the different metrics and your city's estimates for those. So before we dive into that, I just wanted to kind of highlight this legend that we have here that will really help just better orient yourself to the dashboard as you explore it. So across the dashboard, lighter colors indicate better outcomes and darker colors indicate poor outcomes. So keep that in mind as you look at the scale bars and the maps that we have available. Also noting here, the gold bar will always represent your city value. This blue triangle will always represent the dashboard city average. And then whenever you see that green check mark here, that tells you that your city is doing better than the dashboard city average. So with that, we can scroll through all the different metrics and see Columbia's estimates for the metrics. So again, gives you just a quick at-a-glance view, and you can even click on, and once you do that, it'll give you more specific information about that specific metric, like the actual estimate, as well as the description or definition of children in poverty in this example, as well as the data source. So if you're new to the dashboard, I think this is a great place to start to just learn a little bit more about the data that we have, the metrics, as well as your city's estimates. Also on this page, we have the demographics overview, which provides demographic data for your city, including race and ethnicity, as well as percent foreign-born breakdowns, as well as age breakdowns. So you can just get a better sense of who lives in your city and the different kind of age and race and ethnicity breakdowns. Also on this page, we have this demographics by census tract tab, which provides essentially that same information, but in a map view. So you can see, for example, I'll just choose Asian, and as you scroll, it will actually populate this metric map or this map view here, where you can actually hover over specific census tracts and see the percent, the Asian population in that specific census tract. And you can just get a better sense of, who lives in your city and who makes up the specific neighborhoods as well. So that's our city overview page. Now I'll move us into our metric detail page, which is where we can dig into the specific data. So I'll just use children in poverty as an example today. So once you select your metric, there's a couple different things here that I want to point out. First, we have the definition of the metrics, as well as this kind of sense-making statement, as well as the scale bar here. So this information tells you your city's estimate. So in Columbia, an estimated 13.4% of children were living in poverty in 2023 compared to 16.8 across the dashboard cities. So we provide that in this text format as well as in this scale bar view. Also on this page, if there's multi-year data available, you can actually click on the year and see all the different other years that are available, and you can click and see how the estimates may have changed. But it'll always take you to the most recent year of data available, which in this case is 2023. Also, as you scroll down, it will take you to this metric map view, which again provides the estimates, the city's estimates, but at that neighborhood level. So you can actually click on the specific census tracts and see kind of how the estimates vary by neighborhood. So again, you may see the darker colors having those higher rates of children in poverty, and those lower or lighter colors having lower rates of children in poverty. Another cool and new feature that we've added is this customize an area feature. So if you're interested in, for example, a neighborhood that makes up a few different census tracts, you can actually click on the actual census tract and then click to add tract to customized area. And I'm just going to click around for a few just to show you an example. But as you do that, you'll see this weighted average for customized area populate here. So you can see the value for that specific customized area, which is really great. And then lastly on this page, I just wanted to point out that you actually can download both the scale bar and the map as well for you to have for your work, for presentations, to print out however you may want that, but that's also available to you as well. And then moving into our demo details page, here we have the demographic details basically broken down by race and ethnicity groups. We also, it depends on what metric you're looking at, but we also sometimes have age breakdowns and sex breakdowns as well. But in this case, we're looking at race and ethnicity breakdowns for children in poverty. And so we present that in, again, the kind of scale bar format. And so you can see how they vary across different race and ethnicity groups. And again, we have a little kind of sense-making statement to help better understand what the data is saying. Next up, we have our Compare Cities feature, which allows you to compare any two cities available on the dashboard to one another. So if you have a specific city in mind, you can search it up here, or you can use our filter tool, which allows you to just filter out by things like population, location, or even by different population demographics. So I'll just select a few. And once you do that, you can select however more. I'll just choose one right now, but you can select as many as you want. But once you select, the scale bar will populate down here, so you can easily kind of compare and see how Columbia's children in poverty rate is doing compared to Rochester's children in poverty rate. So you can see they're both doing better than the dashboard average and relatively similar, but this is a great tool to just quickly visually see how cities compare to one another. But then as you scroll down even further, we provide those city demographics comparisons as well for children in poverty. And then finally, I wanted to just highlight the last feature, which is our Compare Metrics feature, which allows you to compare any two metrics on our dashboard to one another. So we can compare children in poverty to high school completion, we'll say. And what that will do is it will populate kind of this metric map that overlays the two different metric estimates. So you can kind of see how, specific neighborhoods may see correlations or specific patterns with one another. So maybe in areas with higher rates of children in poverty, there may be lower rates of high school completion, and similarly, lower rates of children in poverty may have higher rates of high school completion. But you can click on and see the specific estimates for that census tract. And then also on this view, on this page, we have this scatter plot view, which again, it kind of allows you to examine potential correlations to the two metrics. And again, every point actually represents a specific census tract. And so if you click on it, it will give you the actual estimate as well. And then finally, on this page, we have our comparison by demographic groups. So it just shows you children in poverty and high school completion by race and ethnicity groups as well, compared to the dashboard city average, more in this bar graph, in this bar graph view. And then the last thing I want to show you on the website before we move on is our data access page, which you can find under data and resources in this access dashboard data. And here you can actually download all of our data completely for free. And we have this kind of filtering system, so you can either do it by metric or you can do it by city. So if you're interested in downloading our data to use for your own work or analyses, you can do that on this page, again, all for free. But with that, I will stop sharing and we can move on to talking more about our CBO opportunity. So I will share my screen and pass it off to Samantha.
Thank you, Avalon. Are you going to share or should I? Okay, you're sharing.
Yes, can you see it?
It is just loading. We could see the website, not the PowerPoint. Or I guess this is the PowerPoint. Perfect.
There, okay.
Perfect. So thank you again, Avalon. My name is Samantha. I'm the program supervisor here at the dashboard, and I work very closely with our users on how they can best engage with our site, engage with our team, engage with our data, in their work to improve local health and well-being for their residents, their constituents, whomever they are working with. And like Avalon said, our dashboard was launched in 2018, but as the years have gone on, it's become clearer and clearer that one of the biggest audience members that we see are community-based organizations. And this was a group that we figured would be in our audience, but most of our, communications and our messaging originally was geared towards like local governments, health departments, and then these CBOs started kind of popping up, and we were like, oh, we need to figure out a way to partner intentionally with CBOs to make sure that they know about our website and our data and are able to use it. So we are really excited to launch this very modest funding opportunity to help community organizations across the country build their data capacity, just in general, but also using City Health dashboard data. Next slide. So I kind of got into this in my intro, but this is a new partnership opportunity. It's the inaugural initiative, and we're hoping to help representatives from community-based organizations use the data, engage with it, and apply the data in their local projects. And we really want this to be not just us teaching at you. We want it to be a collaborative partnership where we support you in honing skills, tools, expertise needed for sustainable data-driven decision making, and for taking action to improve health. And when I say data-driven decision making and taking action, that might seem really large, like we're expecting you to pass a policy or design a new program. And it really can be much, much smaller than that. We've worked with folks in the past who are very much at the beginning of their data-driven journey or their data decision-making journey. And so we find, working with those types of people or those types of organizations where it's like working on like the smallest scale to be of real value. And so we invite and welcome folks or organizations who are really at the beginning of their data literacy or their data journey. Next slide. So logistics about what the grant awardees will receive. So we are expecting to fund around 3 to 5 different CBOs. Each CBO will receive a $5,000 grant. Like I said, it's modest, but we are really trying to create a situation where organizations that are fairly small, mid-size, even some large ones are able to get all of this like expertise, workshops, TA at no cost to them. So like I said, we'll have a set of workshops that, all of the grantees will be available to all of the grantees, and the topics will range from things like data interpretation or data storytelling, data visualization, and will be led by our team. And then we'll also provide one-on-one technical assistance where we can really dig into the big problems facing your organization, the projects that you're working on, and will support your efforts to use City Health dashboard data. And I have some examples there, whether it's creating fact sheets or flyers, or if you're making a presentation to your city council about something and you need to use data to help support support your stance or advocate for your position. Those are the sorts of things that we can partner on during those TA sessions. If you need help drafting social media posts that talk about data or involve any sort of data visualizations, we can work on that as well. And the grant duration will be around 12 months. Next slide. So grant deliverables, there's not many, but we do expect attendance. We're thinking of having 3 group workshops. And so we do expect attendance at, at least one of those workshops. These are as strong as the people that, come to them and engage in them, and, and they're as collaborative as the people that are attending. So we really do want those to be widely attended. And then the up to 4 one-on-one TA sessions with our team. So it's pretty low hanging, I would say, in terms of grant deliverables. And then we are hoping for at the end of the grant duration, or at the end of the project, at the end of those 12 months, partnering with our communications team on a brief use case or success story, just a write-up of how the dashboard data was utilized, or how how the team or the department or the organization engaged with the project or engaged with our team, and what were the impacts of that work over the past year. And this could be something that is used by our team in various publications, but also should be, is free to use by the CBO who we partner with. Next slide. A note or a couple notes about the application. So any organization, as long as they have a 501c3 designation, is encouraged to apply. We wanted to keep it fairly broad so we can capture a wide range of different applicants who might need this sort of funding or this sort of TA. And the application is fairly straightforward and should not hopefully take you that much time, but it asks a mix of questions that are focused on things like your organization's information. So very low hanging fruit, the automatic answers on the SAT, like your name, your website URL, primary contact info, that sort of thing. We'll ask you some questions about your current data use, and we encourage everyone to really to answer that freely, even if it's like we don't use data regularly at all, that's totally fine. We want to hear that. The proposed project or use case. So are you working on something? Are you working towards like a big board meeting in the fall of this year that you need to, create talking points for, create a presentation for? Are you currently working on like a diabetes initiative that could use data or could use, some data expertise on to help you target that program or outreach to your community? So that's that set of questions. We'll also ask you about organizational capacity and readiness. So will you be able, or someone at your organization be able to attend the workshops or to attend the one-on-one TA sessions? And then finally, some administrative requirements. So when we partner with vendors or organizations, we have, a process that we have to go through, just like I'm sure all of you have to go through with your administrative departments to get you registered as a vendor and make sure that we have your banking information, all of that stuff. And just NYU being a very large institution can get a little bit bureaucratic, a little bit complicated. And so just making sure that you have the ability to work with us and work with our grants manager on getting onboarded and all of that. I've created or I've left a link to the application here. Although Amelia, are you able to throw a link to the application into the chat? Thank you so much. Yeah, oh, she was right on it. Thank you. So the application is open. It opened last Tuesday, and the deadline to apply is about a month. So May 15th at 11:59 p.m. is your deadline. And so from there, we will review all of the applications that come in, narrow down, and then selected organizations that, meet a certain threshold will be invited to interview with our team, to confirm that there's a strong mutual fit. And then we most likely will send out, our decision letters, um, you know, before July 4th week. You can count on that. Um, and so that's the CBO funding opportunity. I'm happy to answer any questions about any of this.